Namaskar. I am Dr. Rakesh Garg. Today I am going to discuss one of the very important skill in medical science, which is called as cardiopulmonary resuscitation. Everybody of you must have listened about sudden cardiac arrest or a person who is mobile suddenly faint and fall down because of many reasons, and the cardiac arrest is one of the manifestation of all those events. In this situation, the cardiopulmonary resuscitation is one of the very important aspects to revive the patient. Taking this into consideration, the Indian Resuscitation Council, which is an affiliate to Indian Society of Anesthesiologists, have formulated their own guidelines of CPR in 2017. These guidelines were categorized into three aspects depending upon the need and the place where it is required. For the layperson outside the hospital, a guideline nomenclature as compression only life support (COLS) was made. For trained paramedics and medics outside the hospital, basic cardiopulmonary life support (BCLS) was formulated. And for any resuscitation inside the hospital by trained paramedics and medics, comprehensive cardiopulmonary life support (CCLS) was formulated. So these were the three guidelines which are standalone guidelines that can be done at three different places by trained persons or by layperson, and they were associated with also some important links that needs to be followed and understood by somebody who is doing cardiopulmonary resuscitation for any victim or patient who has gotten cardiac arrest. So today we'll be discussing about the compression only life support (COLS). This guideline is made for layperson if they want to revive some patient outside the hospital who has cardiac arrest outside the hospital. These guidelines has been published in November issues of Indian Journal of Anesthesia in 2017, and the details of these guidelines can be read from this published manuscript which has been published in the Indian Journal of Anesthesia. Now this could be a common scenario. You observe a person who suddenly collapses in front of you, or somebody is already collapsed when you saw him or her for the first time. In this situation, we have to follow certain steps. We need to understand those steps so that the patient's outcome becomes much better. Obviously, we have to recognize the person that he has gotten cardiac arrest. We have to call for help. The other important aspect that needs to be understood is that we have to start the chest compression, and obviously we have to shift them to the nearest hospital. Now these three links are the most important links, and they have been called as core links in the adult CLS. Let's see what these links are. The first is the early recognition and activation. When a patient gets in cardiac arrest, he may be having some premonitory symptoms like chest pain, or he may be feeling dizziness or breathlessness. In those situations, he can subsequently have a cardiac arrest. So we have to recognize the situation that he actually has some issues with the heart, it is not functioning properly, and probably patient requires some type of cardiac support. So once we have recognized them, it has to be done very early at the appropriate time, and then we have to activate the emergency services so that the patient can be shifted to hospital timely. The second important link is that we have to start the early chest compression. We recognize that the heart is not functioning automatically, so we have to provide them external chest compression for these patients. The early we provide, better is the outcome. And finally, patient would require some definite medical care, so we have to shift the patient earliest to the nearest medical facility so that the patient can be managed successfully. Now, these three links, these three concepts, we have to translate into stepwise approach, as this has been done into this algorithm. So we'll go step by step that how these main important components or the links can be translated into actual situation when we are performing CPR for a patient who has got cardiac arrest by a layperson. The first and the foremost aspect is that you have to ensure safety of yourself and the victim. So we have to ensure a safe place. There could be many situations. It could be an accident scenario, it could be a house on fire, it could be a vehicle on fire, it could be a place where there is a risk of electrocution somewhere. So in this situation, some of the areas could be a risky one. So in this situation, if a layperson or a rescuer try to approach to resuscitate a victim, he can harm himself. So we have to look for the scene to ensure that there is no imminent danger or threat to the self as a rescuer, and definitely to the patient as well. So what we have to do in this situation? We have to shift the patient to a safe place. We can take help from the bystanders who are standing there. We can call the ambulance services, we can call the fire brigade people, we can call the police also. So those people will create a safe situation or the patient could be shifted to a safe place so that the patient could be subsequently resuscitated. Once we have ensured the safety of the place by shifting the patient, then we have to check response. Now this response has to be checked while coming from front of the patient, as you can see in this picture. You have to tap on both the shoulders and you have to speak loudly. Are you okay? Just remember, you have to speak in a language that patient can understand. So this means we have using two mode of checking the response. One is we are tapping, that's the tactile stimulus, and we are vocalizing loudly so that patient can listen. In this situation, we have to look for the verbal response or the purposeful movement or the breathing of the patient itself. In case patient responds to this situation, then this means the patient is responsive. The other situation could be the patient is not responding by these three things. In those situations, we mean that patient is non-responsive. If patient is responsive, then this means patient probably have some transient loss of consciousness. He must have fallen because of it. Patient needs to be observed, and obviously this patient needs to be shifted to the nearest medical facility so that the doctors can look for what was the actual reason for patient having a loss of consciousness, and they can be managed. In case patient is non-responsive, in those situations we need some help. So we have to shout for help, and we can call even. All of us nowadays, we have mobiles with us, so we can call from mobile and keep the speakerphone on. If somebody is there in the vicinity, a bystander or some other person, we can call him, we can call for help to him so that he can call for help, so that we can save some time to do the subsequent steps of CPR. Whenever we give a call or whenever we give an instruction to somebody to call for help for the medical emergency, we have to give them certain important information so that the emergency help reaches us on the correct time. So that needs to be remembered by us. Whenever we call to the emergency number, we have to identify ourselves, identify the exact location from which you are speaking, because you want the help to be reaching at that particular place. So you should be very clear about the location. Tell about the victim's condition, including the number of victims, the patient approximate age and gender, and probably if you think he was talking to you, he was complaining of some symptoms like chest pain, you can communicate to him, including the general condition, and the availability of number of rescuers that you have. Sometimes there could be a communication gap when we call somebody on mobile, so assure that the information has been transmitted to the other person, and hang only when you have been asked to do so, so that the help can reach you on the time. Once you have called for help, now is the time to start. One of the very important aspect is the chest compression. So you have to start the chest compression immediately without undue delay for it. Now when we say the chest compression comprises of manual compression of the chest, and this has to be done 30 times continuously for 5 sets. So this means approximately 30 sets, 5 times approximately 150 chest compression needs to be done. Now this chest compression is very important that we should do it correctly, in a correct way, so that the outcome is good. So the first step would be to identify the place where we have to do the chest compression. The best aspect to identify the place for doing a chest compression is, as you can see in this figure, that we have to identify the chest bone, the breastbone, which is also called as sternum in medical language, but we usually call breastbone. So you palpate your breastbone and go on to the lowest border, as you can see in this figure also. So when you go in the lowest figure, just keep 2 fingers above the gyphoid process, that is the lowest end of the breastbone, and keep the other heel of the hand above the first one, as shown in this figure, and interlock both the fingers, as you can see here. Just to summarize once again, you have ensured the safety of the place, you have seen that the response, you have called for help, subsequently you have to start chest compression, identify the lowest end of the sternum or the breastbone, keep your 2 fingers, as we can see in this figure, keep the other hand, the palm of the other hand, heel of the other hand over those 2 fingers, and the second hand over the first one, as you can see in this picture. Once you have done it, you have to keep your elbow straight. Your shoulder, your elbow and wrist should be in the straight line, as you can see this straight line here, and shoulder should be above the victim's chest. So you have to make your position accordingly so that your shoulder, your elbow and your wrist remains in the straight line. Fingers should be interlocked, and then subsequently you have to start compressing on the chest. You have to push at least 5 centimeter, but not more than 6 centimeter. And the speed of this compression should be at least around 120 times per minute. The compression speed should be maintained 120 times per minute, but allow the complete chest recoil between compression without lifting hand from your chest. Do not stop chest compression unnecessarily for other reason. It has to be done non-stop. When you are doing 30 compressions in one set, you have to make a time balance. So chant loudly 1, 2, 3, 4, 5, 6, 7 till 30. So this will allow you to count the number of compressions so that you can maintain the time also. And when we speak louder, the compression speed will be around 120 times per minute. If there are more than one person, the chest compression can lead to rescuer fatigue. You can always change after 5 cycles of the 30 sets of chest compression. Once the 30 set of chest compression has been done, you have to see for the response. Now this response is different from the earlier check response. In this, you have to see that whether the patient is moving, coughing or vocalizing. In situations where these signs of life in the form of movement, coughing and vocalizing are present, this means the patient is probably responsive. If they are absent, this means non-responsive. In case patient is responsive, then again you have to observe the patient. You have already called for help. This means you are observing the patient. The moment the emergency help comes to you, you have to shift this patient to the hospital. In situations, if the patient remains non-responsive, you have to start again the 5 sets of 30 compressions again. So 30 chest compressions, 30 chest compressions, 30 chest compression, 30 chest compression, 30 chest compression. Again 5 times. And then again you have to check for the response. So this cycle will continue till the patient becomes revived or the medical help arrives. Trained rescuers are available with you, or sometimes the patient gets revived where there are obvious signs of life. At times the rescuer becomes exhausted or the place becomes unsafe. In those situations, you can stop the chest compression for a moment. In case there is somebody nearby, you can take their help so that the chest compression could be continued further on. In case the patient is responsive and you are awaiting for the emergency services or the ambulance that comes to you, at this moment of time, you can place the victim in lateral position. So this is how you can single-handedly, single person, you can do a lateral position of the patient. If a patient is lying supine, you can see in this figure, you can just fold the arm of the victim as shown in this figure, and then put the other arm across the chest, across near the opposite side of ear. Fold the limbs on the opposite side to a 90 degree, and holding the shoulders and the knee, you can twist them to lateral position, and this position appears to be quite stable position. In case of a patient have some vomiting, then he will not be aspirating the contents will not go into the lungs. Also this patient will keep the airway open. So keep this position, but then remember you have to observe the patient quite frequently here, maybe every 1.5 to 2 minutes. And in case if you think that patient is having some issues, you can make him supine again and start and look for whether patient requires subsequently again the chest compression. There would be a situation in which you find a victim which has collapsed, but the situation will be that you don't need to start the CPR. The situations would be if the scene is not safe, because your safety will be at risk. The patient is responsive. Patient has signs of irreversible death like the rigidity, the rigor mortis. If such situation happens, you need not to start the CPR in this situation. So in a nutshell, we have just talked about doing chest compression only life support, cardiac compression only life support calls for patients who sustains cardiac arrest outside the hospital. And in case if any laypersons wants to do CPR, we have to follow this algorithm, this chain of links, so that the patient survival becomes much better. The more information can be seen from this website, www.cprindia.in. We have all informations related to layperson CPR on this website that you can look for. If you have any queries, you can get back to us for any subsequent training programs related to the compression only life support, which is an initiative of Indian Resuscitation Council. Thank you so much.